So hello students, today's topic that I'm going to discuss with you is the dental bleaching topic. So are you guys ready? So let us start with it. So number one, what is dental bleaching? So it is the lightening of the color of the tooth through the application of the chemical agents. So what are the chemical agents? We will discuss them again after some time. So before that, you should know is how these bleaching agents will work. How will they act? So remember, it will oxidize the organic pigment that is present in the tooth, that is referred to as bleaching. So how the bleaching works? What is the mode of action? Remember, the bleaching, it is based upon the oxidation of the bleaching agent. So there is oxidation of. So what happens is the redox reaction that take place in the bleaching process. So before the bleaching process, remember the teeth is reducing agent. So the teeth will act as a reducing agent, and the bleaching material, that is the oxidizing agent. So but after bleaching, what you see is the tooth that will be oxidizing. The tooth is oxidized, that is the organic pigment of the tooth is oxidized, and the bleaching material, it is reduced. So what actually happens is in the saliva there is present carbamide peroxide. So that converts into hydrogen peroxide, that is the active bleaching agent, and urea. So the hydrogen peroxide, this hydrogen peroxide would typically generate short-lived oxygen products. What are those? They are perhydroxyl radical and hydroxyl radical. Now, what will these do? Suppose there are discoloration here. What these radicals will diffuse. So these are the area of discoloration, and these radicals enter into the enamel or the dentine, and what they will do is they just diffuse to the area of the discoloration. So they will diffuse to the area of discoloration and break down the double bonds in the discolored or stained areas. So what the outcome you see will be a whitened appearance. So that is how the bleaching action take place. So knowledge is power, and you should know when to recharge your battery. So coming to the MCQ portion that can be asked in your exam, that is the most common classification for the tooth discoloration was first described by Natho in 1997. So remember the classification, the most common classification for tooth discoloration was described by Natho. So it is divided into type 2 and type 3. So what is type 1? In the type 1, what you will see is the colored material will bind to the tooth surface to cause discoloration. So the tooth has the same color as that of chromogen. But in case of type 2, what you will see is the discoloring agent is type 1 food stain, that will change the color to the darker after binding to the tooth surface for certain amount of time. And whereas in type 3, it is in type 3, a pre-chromogen binds to the tooth and undergoes a chemical reaction that causes a stain. Now, what are the bleaching materials that are used? So the most commonly used is the bleaching material will be the hydrogen peroxide. So remember, hydrogen peroxide, it is the most commonly used bleaching material. It is available as superoxole. So remember, what is superoxole? It is 30 to 35% stabilized aqueous solution. So the 30 to 35% hydrogen peroxide is known as superoxole. So what you should know is hydrogen peroxide. It is the properties of hydrogen peroxide. It is colorless, it is odorless, it is unstable, and so that is why since it is unstable, so that is why we keep it away from the heat. It is stored in the light-proof amber bottles. Now, second bleaching material is carbamide peroxide. So that is also known as a urea hydrogen peroxide. So it is a derivative of carbonic acid. It is available in concentration of 3 to 45%. Third is the sodium perborate. So remember, when fresh, it contains about 95% of perborate. And remember, it is stable. It is stable when dry. So it is available as 3 types: monohydrate, trihydrate, or tetrahydrate. So they differ in the oxygen content. So that will determine the bleaching efficacy. Now let us discuss what are the types of bleaching. They can be either vital or non-vital. So in the vital or non-vital, is performed, it can be either in home or office. So what is non-vital bleaching? So the non-vital bleaching means pulp is necrotic. So when the discoloration is from within the pulp chamber, that is from the necrotic pulp or from staining agent that are present in the pulp chamber. So here the bleaching treatment need to take place within the pulp chamber. So what should be condition for the non-vital bleaching? The tooth should be discolored, non-vital. The gutta percha filling should be well condensed. There should be no sign of periapical disease. So that is must. So what we have to do is take a pre-operative X-ray, apply rubber dam, clean the tooth with the pumice, remove the chamber restoration, remove the filling to the level of dentogingival level, and place a barrier 1 mm of the cement, and mix the hydrogen peroxide and perborate and place it here with the plastic instrument. It can be activated with heat and place a dry piece of cotton over the perborate mix, and temporary filling can be given overnight. So over root filling material, what we do is, over the root material, what we do is we place a barrier. So what is the role? What is the role of this barrier? What should be minimum thickness of this barrier? So without this protective layer of the barrier, what bleaching material do is it may penetrate the bleaching material. This bleaching material will penetrate the root filling toward the apical foramen. So what should be the color of the barrier material? Yes, it should be white. Why? To avoid further pigmentation. So the color should be white and a protective layer of at least 2 mm thickness that is placed over the root filling material. So the next question is, what white material should be used? The material that has been suggested include the glass ionomer cement, intermediate restorative material, cavite, zinc oxide eugenol cement, or the zinc phosphate cement. So other point is a protective barrier that is placed at the cemento enamel junction that will reduce the risk of cervical root resorption. And damage to the periodontal ligament. So the vertical outline of protective barrier should be 1 mm coronal to the cemento enamel junction, lingually, labially, and proximal to cemento enamel junction area. Now let us discuss the techniques that we use for the non-vital bleaching. What are they? They are, number one is the thermocatalytic bleaching, or that is walking bleach, or inside outside bleaching. So first, discussing the thermocatalytic bleaching or in office technique. So thermo means heat. So what we will use here is a heat activated solution. So next question, what will the heat do? It will activate the solution. So the heat solution, what it will do is create forming of hydrogen peroxide with release of free radical oxygen. Now, question that comes is, what is the solution that is used and what is the procedure? So the solution is 35% hydrogen peroxide that is placed into the pulp chamber, and it can be accelerated by using a heat instrument into the pulp chamber. So what are the heating device that we can use? The heating device that we can use is touch and heat, system B, Cybron Endo. So what products can be used to prevent overheating that act as a thermal insulator? So we can use is Vaseline, Ora base, or cocoa butter. Next comes the walking bleach or out of home technique. So in this technique, we use is the superoxole. That was 30% hydrogen peroxide by volume or mixture of sodium perborate or superoxole that can be used. Coming to the vital bleaching techniques. So the vital bleaching techniques that can be power bleach or in office technique or night guard or dentist prescribed home techniques. So first comes the power bleach. So in the power bleach, what we use is 35% of hydrogen peroxide, and the oxidation process, it is accelerated by light. So in this technique, the high intensity light, which was used as a heat source, is replaced by conventional halogen light, plasma arc lamps, etc. So what are the heat source that we can, what are the light source we can use? One is the tungsten halogen curing light. That is the standard dental curing light that provides the heat and stimulate the initiation of the chemical reaction by activating the light sensitive chemicals that are present in the bleaching agent. So depending upon the manufacturer recommendation, the bleaching time is 30 to 60 seconds per application per tooth. So that is a really time consuming for the patient. So as you know all, time is money. Time is your money. So don't waste it. Read, retain, revise. These are the three pillars of the success. Other we can use is the xenon halogen curing light. So these are the new generation xenon plasma arc lamps. They are based on the thermal activation. The light is of highly intensity that produce a great heat. So what will this high heat do? So due to high heat, there is potential for the dental trauma to the pulp and the surrounding tissue. So that is why these lights have been used with the great care. So this question was asked in your NEET exam. What we follow is LED lamps. Why? Remember, they emit cold blue light with a wavelength of around 465 nanometer. So that causes activation of hydrogen peroxide and accelerate the bleaching process. So the LED lights, they are placed close to the patient teeth for 15 to 20 minutes, which may have been to be repeated for 3 times. So why we prefer them? Because here no heat activation is required. This was asked in your NEET exam that we use the LED lamps use cold blue light. Other is the laser bleaching technique. So when the source of activation is a laser, it is known as a laser bleaching technique. So another MCQ that can be asked in your exam is, what are the lasers that can be used in bleaching? So remember, carbon dioxide, argon, and diode laser are the type of lasers that we use in bleaching. So remember this for your exam. Another thing that you have to remember is cervical resorption is a common sequence of bleaching of non-vital teeth, whereas I repeat, cervical resorption is a common consequence of bleaching of non-vital teeth, whereas apical periodontitis is for vital teeth. So this question has been asked many times in exam. So remember it. Next, we are going to discuss is the night guard technique or the home technique. So the mnemonic to remember is, think you are driving a car in the night. So bingo. For the night guard, you use a car. That is, solution that is used is carbamide peroxide. What concentration do we use? We use is 10 to 15%. So that can be applied with the help of these bleaching trays. So remember, the carbamide peroxide, it degrades into 3% hydrogen peroxide and 7% urea. So what are the alternative techniques that we use apart from the bleaching? We can use is the micro abrasion. It is alternative to bleaching with the peroxide compound for superficial irregularities and shallow intrinsic stains in the enamel surface. So what we use is the 18% HCl solution. So remember it for your exam point of view. What we use is 18% hydrochloric acid solution with the fine pumice powder that is applied to the tooth surface. So what we use as a rotating rubber cup that is used in a slow speed with light pressure to distribute the paste. So the paste should be placed on the tooth for about 5 seconds, followed by rubber cup activation for the 15 seconds. So if the stain is not fully removed after many times, the procedure should be terminated to avoid permanent tooth damage. So this was all about the bleaching procedure. We will come up with more topics in future. That was all for today.